welcome in Stephen Dodsworth, who is joining us from Reyes. Is that correct? Stephen is a scientist, he's an entrepreneur, he's an executive. He's done a lot of interesting things in a more than 15-year career in healthcare. He holds a PhD in molecular immunology, among other things. And he founded during the pandemic, DHV Net, Digital Health Virtual Network, based on a lot of his connections and contacts, really trying to build and solve for digital health innovation, not only in the UK and in the EU, but definitely has had an influence even over here in the US. Steve has some great and unique perspectives on digital. So Stephen, I know you want to probably do a little bit more of an intro, but that would be the first question that I have for you is what's going on here? Why is it taking so long for something like digital health to become mainstream?
Really appreciate the invite today. And in order to answer that question, maybe I'll take a little bit of a tangential approach. What actually happened was I was a life scientist and I kind of got interested in strategy, was asked to develop a life science strategy. Did a lot of homework around 2008, 2009, picked up on all the trends that you'll be familiar with, so I won't repeat them. But within a couple of years, we realized that it was really difficult for this new thing at that time, digital health, to be accepted by our healthcare providers. And so let me just try and illustrate the dynamic that kind of underpins probably the whole discussion today. So our healthcare systems grew up in a really different age, characterized by battlefield injuries, farming accidents, bacterial infections. And so in those circumstances, you were taken from the farm or the battlefield. You were taken to a center populated by medical experts who pretty much decided what they were going to do to you. And so they treated you after a period of rehabilitation. You then went back to the farm or battlefield. And our acute-based healthcare systems, grew up in that environment. And so it's been a real challenge to change from that model to address the challenges that we all recognize today. So this phenomenal sustained rise in chronic disease, burden of an aging population, which in itself is a success story, better medicine, sanitation, food supply, and of course, this global healthcare, sort of shortage of healthcare workers. So our systems grew up and they became more complex. And now we want them to change, and digital health companies want to help that change. And so one of the questions we were just kind of raising amongst ourselves is, as a digital health company, do you go for the money? Because it's complicated, but there's a lot of money that flows through our existing healthcare systems, old school healthcare systems. Or do you try and front the revolution and try and change things by introducing new approaches to change the way that we deliver healthcare, which we have to do to cope with the crisis that's facing us. But if you do that, it's far more difficult. So that, I think, is the fundamental landscape and almost the decision as a startup. Do you go with the money? Do you go with the establishment? Or do you do the kind of good of man thing and try and help everybody to change healthcare and try and make some money in the process?
That's a great analysis. And one of the things that I had been observing for a while, and probably very bad, it's like the system is designed to do exactly what it does very well. Like the system is actually designed well, but the problems that we're having coming in are not the same problems. And so I really like your analysis on that point, because one of the things I've said many times is the system works well for what it was designed for. It does not work for the problems that we have right now. And so as you're looking at innovation and you've been doing this for 15 years, give us some idea of what are the main challenges, if you could break them down into categories of go-to-market strategy versus the actual innovation itself, like what's the focus on digitization versus a digital strategy?
Yeah, to try and cover all the categories of challenge, I think we've only got half an hour today. So one of the things that I do in the background is I assess business proposals for a number of organizations. And I've got a life science background. So the first half of my career was in the life sciences, what I call traditional life sciences, so genomics, genetics. And when I read a business proposal from the life scientist, generally routes to market are known, business models are known. you can be pretty confident, if someone's developing drugs, there's a certain route forward that, is tried and tested. And I still am a real enthusiast for digital health, but as soon as I see digital health application as the weakest part of the proposal, is typically the business side of things. And there are several parts to that even. One, as demonstrated in 2023, quite spectacularly in digital therapeutics, is if you don't adhere to the basic principles of business, if you don't know who your buyers are, if you don't know how long it's going to take you to reach market because the regulatory pathway is unclear, you're walking a really, it's a tightrope. And so if you don't adhere to the basics business, it's very likely that business is going to bite you for some reason. And it's largely attached to routes to market and the fact buyers who should be buying are very reticent to buy. Then that fundamentals business rule category seems to trip up a lot of people. No one's born with experience, but with the amount of advice I've provided by governments, government agencies, consultants, that shouldn't be a problem, but it seems to be a bigger problem in digital health. Maybe it's because people are so passionate and enthusiastic about what they're doing that almost goes ahead of the basic principles. And then the other thing, and we've already touched upon it, is what's your route to market? Who are your buyers? And the people who should be buying, big style, in order to change the way that we deliver healthcare. Buying because it's complex to change, and it's almost easier just to carry on doing things the same way. So whilst there are examples of success in different elements of the kind of buying spectrum, I'm actually impressed by some of the smaller companies who get really creative when it comes to go to market. And they've got really novel approaches, but not kind of out there approaches, very grounded, but maybe things that are not commonplace you wouldn't see on LinkedIn. So those, I think, are the two major categories from a startup perspective. I think it's maybe even a different world when you try and see digital health through the lens of payers and providers.
When you were talking about kind of the biggest weakness or gap being the business focus, I interpret that as not aligning with the current systems and ways of doing business in healthcare, but we need new ways, right, of doing business. So there's not necessarily these established pathways or channels for that. But it also brought to mind this tension between business and science. And something that I've encountered is also a lack of agreement on what science is. So there's health science, there's behavioral science, and I believe there should be more social science included in healthcare. There's social determinants of health have become very popularized and accepted. Yet, at least in the US, there are providers who have spent time telling me that they believe social determinants of health do not belong in our healthcare system. That our healthcare system should not be addressing them, even though 90% of our health issues are directly tied to them. So there's not an agreement on what science is or what science belongs in healthcare. So I'm just curious what your perspective is on balancing the business objectives and like the science of what we know actually solves health issues and can improve patient experience and outcomes.
Great point. Fascinating area for discussion. So I was brought up in life sciences, put it that way. Those are my formative years. I was a bench scientist. And scientists deal with kind of bits of living things. If I'm brutal, we don't really think about people too much. It's just, molecular level or organism level. It's very different to the thinking in healthcare, which is kind of about people. But the big difference I see between traditional healthcare, life science, and digital health is digital health really tries to involve people in a way that maybe traditional healthcare doesn't. Remember my phrase about healthcare, some medical experts deciding what to do to you. There aren't really any new fields of science involved in digital health, but it's such a melting pot. If you're looking to change people's behavior, which is a big part of dealing with chronic disease, you need anything from psychologists, retail psychologists. You need a very different, or at least a bigger team than if you're dealing with molecules. And then the next level is social determinants of health. I'm not sure about the discussion in the US, but in Europe, it's a big discussion. And talk to the providers, the sort of universal providers, public funded, and everybody understands the issues and government understand the issue. It's just very difficult for healthcare systems to control factors which are largely outside of the realm of healthcare. So in the UK, there was a very successful anti-smoking agenda, which had really, really made a difference. But they're quite few and far between in terms of examples. And so the one thing that really struck me, I used to do a lot of presenting in the real world on stage before the pandemic, and I used to have something called the Grim Quiz. And so I'd just go to government websites and find the most shocking statistics that I could. And we'd have a bit of a grim quiz to start the session. Everybody there was interested in healthcare, and you could see everybody reeling because these are shocking stats, even if we really should know them. And the most prevalent cause of disablement on the planet is depression, because life is so damn difficult for most people. Anything from just read the news headlines, what's happening in the wars across the world. But even living in the Western world is becoming increasingly difficult. And so our healthcare system is just deal with that collateral damage. As a healthcare provider, you can't solve wars even. You can't do anything about housing. And so it's a really, really difficult problem to solve. But that's what I love about digital health is some companies out there actually reach out and try and build on these social determinants of health and build models to actually try and affect that change. But it is working against the system. So whilst I'm an enthusiast and I applaud such people, I actually think business-wise, they choosing a much harder route than simply being part of the established system.
That's fascinating. And what a great thought too. And I remain enthusiastic about digital health while also understanding the barriers to entry for young companies coming in. And so social determinants, as you said, is a hot topic here. We run through new cycles where it was all about AI and then it was about social determinants. Now we're back to the AI is really going to solve the problem for us, right? But I also noticed, and maybe you've seen this in the UK and the EU as well, the opposite of fear of missing out when you're talking about investing inside of digital health or healthcare in general is that these systems and even the investors don't want to really put their money or their time into something that isn't already proven. So rather than spending some time and innovation cycles building something, they would rather wait for the next person to do it and then jump on the bandwagon, which I think is also another interesting way to think about the barriers to entry for innovators is that you can't get anywhere unless you have proof, but you can't have proof until you get someone in early to help you with that. And just your thoughts on that as well seems to be also the other problem when it comes to investing. So maybe think about it also from like who's investing in the EU and the UK and these kind of things and what are their metrics for success?
I must admit, earlier on in my career, I used to think investors were really sophisticated outfits who obviously dealt with, huge amounts of money and were very careful. And some are, but you don't have to look far and not just in digital health and healthcare. Think of the dot-com boom. To see massive amounts of money thrown at things, there's no real basis, the Theranos side of things. I remember early in my career, I was the guy in the white coat and the pipette, and someone came into the company that we worked in and said, "They've built this fantastic technology for purifying DNA from blood." So we said, "Take you out for lunch, give the guy in the white coat a chance to have a look at this." It took me a couple of hours. Me and the team all chipped in, and we just couldn't find the evidence that it worked. And so I think in terms of investors, there's a lot of the phrase, sadly, dumb money. And the pandemic saw a lot of dumb money flung around, and it hasn't actually done the industry any good. And so whilst it's very painful at the moment, and last year in particular, I think we'll emerge into a slightly healthier space. But to go back to your point, there's one corporate who's very famous for being second to market. So they'll wait until someone goes into market successfully, and then they've got big resources. So they'll just go and move them to one side. And there's an element of that, I guess, in digital health. But for all, and as I say, I've been doing this for 15 years, I guess telehealth, it's pretty established now. Even mental health, I used to think was one of the more sophisticated segments. But actually, when you look at it carefully, when you really look at the evidence, there's some success. Some studies show very limited success. So I don't think there's too much in the way of kind of second to market stuff. The exception, I would say, is anyone who's hoping to solve pharma's problems is probably onto a good thing. Pharma knows it's making a lot of money still, but it's interested in creating efficiencies within its long-standing processes. And for all the slight panic of pharma interest in digital health in 2023, yes, it is. Wants to see more solid evidence, but pharma is there and it is buying and it will move forward. And so, strangely enough, for all the glacial-like speed at which pharma moves, I actually think they might be more influential going forward than our traditional healthcare provider.
So I think that's an important observation about pharma. The first thing that comes to my mind is that they're also the most well-endowed financially for various reasons. So I'm curious, what your thoughts are and, why they're best suited to lead the charge. And then my question is, I think related, if most digital health startups are really focused on addressing root causes, solving health issues, or, maybe just being a little too, you say, revolutionary, what's another way? Like, do you see venture studios? Do you see other examples of how to innovate in healthcare that isn't too far outside the system? So it's more, going along that traditional business path, yet can stepwise move towards, more patient centricity.
Mind me of that point in a second, Mary Beth, if I kind of get distracted by pharma, because that's a really interesting question. Pharma, okay, I had a conversation with a consultant who used to work for one of the very well-known DTX companies, but one of the DTX companies who actually know their market and know the difference between well-being and can play in that space as well as the regulated space. It was actually a prep call for one of our DH3net events. And they said, yeah, it's been a tough year for DTX companies. Pharma is really sort of taking stock. And as a throwaway comment, I said, the marketing arm of Pharma never tire of apps that, let them engage with their audience and pull data back. And it was a throwaway comment. And yet that is a mainstay for a lot of digital health companies that I've seen. It doesn't require regulation. In fact, a lot of pharma companies would prefer not to deal with a regulated app. It's less risky. And so if you want to kind of follow the money and follow the established process, pharma marketing is not going anywhere quickly. It's had a bit of a hard time, so they're looking for new ways forward. Clinical trials, they're still expensive, time-consuming, risky. Anybody who can build confidence, introduce efficacies into that process is onto a winner. The rise of digital biomarkers within pharma, whilst if you want to throw stones, you can say, where's the success? It's still early days. It is, but the potential offered by that technology is so huge, I don't believe any pharma company will want to be left behind. It is one of the genuine cases of disruptive digital health technology that I think will be embraced. But pharma is a business. And in Europe, we have kind of universal healthcare providers. In the US, we farm. Familiar with it. It's a business that does a job. And so that second point that you raised, is it possible to do something adjacent to or on the fringes of healthcare? The one thing I find absolutely fascinating at the moment is it's a US phenomenon, but it is extending beyond the US, is this aggregation of, at the moment, DTX technologies. So everyone's familiar with the phrase point solutions. It's a fair point. If you're a company, you sell one particular solution to a problem, it's better if you've got a kind of comprehensive offering where you can join up services. I'm intrigued by that possibility because as we get further into this crisis caused by burden of chronic disease, an aging population, healthcare worker shortages, our systems, and I'll do this in the recorded bit because these are not conversations that people are very comfortable with publicly, but I think they should be public. Our systems are beginning to fail. Everybody, I'm sure, knows someone who's had some adverse experiences. I was actually chatting to a CEO of an American company who's got superb insurance, and he was saying just the quality of care. He can get the care, but the quality was appalling. In the end, he addressed it himself. So even if you've got money, it seems difficult to get the right quality of care. And it's only going to get worse because we can't change the way that we're delivering healthcare to these problems. So I've just been waiting for the last couple of years for a new provider to go, okay, this digital health thing seems sensible. It's trying to actually deliver healthcare in a way that's more appropriate for these major challenges. No other healthcare provider seems to be rising to that challenge for whatever reason. And so can we take all these intriguing pieces that seem to now be working, or at least there's an evidence base to show some? Can we put this together in a very efficient way? Because that's one of the beneficial parts of offerings of digital health. Can we put it together in a way that's virtual, but interacts with physical services to actually kind of create the healthcare system that we should have on the back of digital health? And I do believe it's just starting to be possible. And the aggregators that you see in the US who are now kind of bundling up the DTX services, just watching to see if one of them goes, okay, yeah, we've kind of done the basic stuff. Now let's take it to the next level. Because that will be really intriguing when someone actually packages up everything that's now available. Because 15 years ago, this was all theoretical. Now there's a substance to it. Can someone then start to deliver a healthcare service that's affordable, efficient, and is appropriate for the challenges ahead?